Acute kidney injury, also known as AKI and previously called ARF, which is acute renal failure, is a clinical syndrome which is basically a result of a dysfunction of the kidneys, and this dysfunction results in an increase or retention of certain products within the blood that are normally excreted by the kidneys. So you know that the kidneys work as a filter, and they filter the blood and they filter the components of the blood. And if the kidneys aren't functioning properly, then this filtration process doesn't work very well, and what's supposed to be filtered out actually begins to accumulate within the blood. Now, if this happens within a short time period, so it has a sudden onset, then this is what we call acute kidney injury. In actual fact, if it happens within a 48-hour window, this is acute kidney injury. Now, the way that AKI manifests clinically is, one, the patient will have an elevated serum creatinine. So, patient may have an elevated serum creatinine. So what's elevated serum creatinine? Well, serum's referring to the blood, elevated means it's increased. What is creatinine? Creatinine is a byproduct of creatine phosphate in the muscles, so a way to deliver energy to the muscles, and it's a byproduct. And this byproduct of creatinine is produced at a pretty constant rate within the body, and then it's filtered out through the kidneys, also at a constant rate. And so measuring serum creatinine, how much creatinine in the blood, is a good direct or indirect measure of renal function. So if you have increased serum creatinine, it means the kidneys aren't filtering properly, and again those products are increased within the bloodstream. You can also have a look at the other nitrogenous wastes within the blood, and so you can look at the blood urea nitrogen, which is sometimes seen as BUN, and again, if you see an increase in BUN, then it's an indication that there's these products that are accumulating in the bloodstream. What else? How else does AKI manifest with the patient? Well, oliguria. Oliguria is a reduced urine output. Okay. Now again, renal dysfunction, reduced urine output, which is oliguria, is not uncommon. Okay, that's the way it manifests, but we need to talk about exactly what AKI is and some of the subcategories of AKI. Well, you can categorize AKI into 3 subcategories. And it actually has to do with the location in which it affects the kidneys. So, basically, the first is pre-renal. The next one is intra-renal. And then finally, post-renal. So, if you have acute kidney injury, and this is happening before the kidney, then it's recognized as being pre-renal. If you have acute kidney injury and it's happening at the tissue of the kidneys itself, so this could be the glomerulus, this could be the interstitium, this could be the tubules, this could be the vasculature of the kidneys, and this is intrarenal. It's also known as intrinsic renal. And post-renal is everything after the kidneys, so this has to do with the ureters, the bladder, and the urethra, and usually it's an obstruction in one of those tubes or pipes. So what I want to do is start with pre-renal. Okay. Now, if we look at pre-renal, we want to have a look at, firstly, what's going to cause pre-renal. Okay. Now, I said it's everything prior to the kidneys, and basically what it is something to do with the blood flow going to the kidneys. This is what pre-renal kidney injury is. Some problem with the blood flow going to the kidneys. Now, what's this blood flow issue? Well, basically, it's anything that will result in hypoperfusion of the kidneys. So hypo meaning under, perfusion is the blood that goes to tissues that can actually effectively participate in gas exchange and so forth. So hypoperfusion is not enough blood going to the kidneys in order for the kidneys to do its thing. Okay? Now, this hypoperfusion, how can this happen? What could cause hypoperfusion of the kidneys? All right. First thing that you need to be aware of is hypovolemia. Again, hypo meaning under, volemia is referring to volume. This is a reduced blood volume in your circulatory system, right? So what could cause hypovolemia? Now, does it make sense that hypovolemia can cause some sort of kidney injury, pre-renal kidney injury? If your blood volume is low, then your blood pressure is going to be low, which means the blood going to your kidneys will be reduced, which means your kidneys won't be able to filter properly. And the tubules and so forth of the kidneys won't be able to be fed the oxygen either. So you can get kidney injury. And because it's happening prior to the kidneys, it's a pre-renal injury. So that's what you've got to think about with this. With pre-renal, something's happening to reduce the oxygen delivery to the kidneys and also to reduce the filtration process of the kidneys. Okay? So, what could cause hypovolemia? What could cause reduced blood volume within the body? Well, a couple of things. One could be trauma. So, somebody could have some sort of cut or damage in which they bleed out and hemorrhage, right? So, trauma. You could have burns. So, a patient or a burns victim, again, may lose a lot of fluid through that type of cellular or tissue damage. What else could reduce blood volume? Well, maybe if a patient's taking diuretics, right? So if a patient takes too many diuretics, then they're going to be peeing out too much. And if they pee out too much, they're losing a lot of blood volume. It could be an issue with the GIT maybe, gastrointestinal tract. So maybe the patient is vomiting excessively, or maybe has diarrhea as well. So these are some means in which a patient can lose excessive fluid and end up being hypovolemic. Okay, so that's one means. What's another means of pre-renal disease? Decreased cardiac output. Decreased cardiac output. So you've got to remember what cardiac output is. So cardiac output is how much blood is ejected from your heart every minute. Now, it's around about 5 litres of blood that's ejected from your heart every minute. And so this is what's required to have adequate tissue perfusion, which means adequate blood flow to your body to feed them. Now, if we reduce cardiac output, so if we reduce that blood volume, we're going to, again, reduce blood pressure, reduce the amount of blood going to the kidneys, and reduce renal perfusion and get hypoperfusion. So, what could cause a reduced cardiac output? Well, basically some sort of heart disease. So you could have congestive heart failure, and you could have some sort of valvular issue as well. These are just a couple of examples. You could have a pulmonary embolism. All these types of things can reduce one's cardiac output, and therefore may result in pre-renal kidney disease. Okay, what's another one? Well, you could have systemic vasodilation. Systemic vasodilation. Now, I said to you that a pre-renal cause of acute kidney injury has to do with hypoperfusion, not enough blood getting to the kidneys to feed it and for filtration to occur. And we said this can happen if your blood volume is reduced, true. It can happen if your cardiac output is reduced, yes. And it can happen if you have a normal blood volume, so you've got normal amount of blood in your body, it's just distributed poorly, okay? Now, I want you to think about what that means. If you tell your blood vessels, your systemic blood vessels, or even peripheral blood vessels, to dilate, then you're pushing the blood into certain compartments and areas in which it's going to, 1, reduce blood pressure, and 2, reduce perfusion at certain tissues. So things that result in systemic or peripheral vasodilation can change your blood pressure and result in hypoperfusion, okay? So what could cause this? Well, anaphylaxis, for example, can cause systemic vasodilation. Anaphylaxis is that hypersensitivity response in which you are being stimulated by something that's coming into your body, triggering an immune response, and you release all this histamine as one of those chemicals. And histamine is a peripheral vasodilator, or at least a systemic vasodilator, okay? Another thing is sepsis. Sepsis is also results in systemic vasodilation as well. So patients with anaphylaxis and sepsis can get systemic vasodilation and can cause acute kidney injury via the pre-renal mechanism. Anesthetics as well. Certain types of anesthetics can result in systemic vasodilation. Okay, what's another one? Well, another pre-renal cause could be afferent arterial constriction. Afferent arterial constriction. All right, what am I referring to? If I were to draw up the glomerulus and the rest of the nephron, here's my friend Zach Nephron. Yeah? Okay, so here's the nephron. Remember, you have an afferent arteriole coming to the nephron. So this is a blood vessel coming to the nephron, and then you've got the glomerular capillaries here, and then you've got the efferent arteriole coming away. So afferent coming in, efferent coming out. Normally, if we want, because this is the site of filtration, right? So you're coming in, you've got a certain amount of blood pressure, and it's pushing through, and you're filtering all those products within the blood. Perfect. How does this happen? How do we keep this pressure in the glomerulus at an appropriate pressure? Well, one thing we can do is we can dilate the afferent arteriole. We can widen that so more blood volume gets in. The second thing we could do is we could constrict the efferent arteriole, and this is going to result in a backlog, so more blood coming in with less coming out, which means right here the pressure increases and gets to filter everything out. That's what happens in the body when we want to increase this glomerular filtration rate. Okay? Now, if we get afferent arteriole constriction, that means the afferent arterioles are constricting now, which means we are reducing the amount of blood going to the nephron, going to the glomerulus, which means that's renal hypoperfusion. That can result in a pre-renal cause of acute kidney injury. How does this happen? Okay, well, first thing is this. There's some substances in our body, which if you've watched the NSAIDs lecture, are called prostaglandins, and these prostaglandins do so many different things in the body. One thing is that they vasodilate the afferent arteriole. So what stops prostaglandins from being produced? NSAIDs. And so if a patient is taking too many NSAIDs or abusing NSAIDs, non-steroidal anti-inflammatory drugs, that's going to be aspirin and celecoxib and ibuprofen, for example, that's going to result in afferent arteriole vasoconstriction. Okay? All right, you can also get efferent arteriole vasodilation. So that means if we constricted the efferent arteriole so that the pressure increased here and we got perfusion, but if we tell that to dilate, then the blood's going to come in and come straight back out again, and the pressure here will be low again, hypoperfusion. What causes, in a normal individual, the efferent arteriole to constrict? Angiotensin II. This is where you need to have a good understanding of the renin-angiotensin-aldosterone system. Angiotensin II is an efferent arteriole vasoconstrictor, which increases glomerular filtration. So if you give a patient an angiotensin II antagonist of some sort, or if you give them a medication which stops the production of angiotensin II, remember the enzyme that does this? That's called ACE, angiotensin converting enzyme. So if you give a patient an ACE inhibitor as well, or an angiotensin II antagonist of some sort, this can also result in efferent arteriole vasodilation and may potentially result in pre-renal causes of acute kidney injury. Okay, let's move on from pre-renal and let's go on and talk about intra-renal causes. All right, so intrarenal is telling you it's happening to the kidney itself, so the tissue of the kidney, which means it can happen to the vasculature of the kidney, it can happen to the glomerulus. It can happen to the interstitium, so the place or the space between the cells, the interstitium. And it can happen to the tubules of the nephron. Let's just draw a line here to separate it from pre-renal. Okay, so intrarenal vasculature. So if you have some sort of damage to the vasculature of the kidneys, this can result in an intrarenal cause for acute kidney injury. So this could just be trauma, for example. So some sort of trauma, so direct damage to the vasculature. It can also be due to some sort of microangiopathy. What's a microangiopathy? Some sort of damage which has occurred to these small blood vessels. Okay. Now this could be some sort of thrombocyte that's formed, some thrombus. It could also just be caused a number of different ways, damaging the endothelium, so the epithelial tissue of the blood vessel as well. Okay. What about the glomerulus? Well, we know the glomerulus is that area where the capsule is and you get that filtration occurring. So if you actually get damage to the glomerulus, this is actually called acute glomerulonephritis. Acute glomerulonephritis. Now, what's the most common cause of acute glomerulonephritis? Well, it's some sort of immune response. There's actually a couple of different immune responses that can occur where you get some sort of immune protein complexes forming, and it can damage the glomerulus and the basement membrane of that glomerulus itself. One of the common causes can be due to a bacterial infection. When your body's trying to fight off the bacterial infection and produces antibodies against it, that can actually result in acute glomerulonephritis. Okay, what about the interstitium? Well, you can have something that's called acute interstitial nephritis. Now that's telling you that you're having some sort of damage to the interstitium, so the connective tissue between the cells themselves. Nephritis, inflammation of the kidneys. It's some sort of allergic response which is happening. Some sort of allergic response. And this allergic response is actually quite commonly caused by drugs. And actually, some of those drugs quite commonly are antibiotics. What about the tubules? Well, this is where we get damage directly occurring to the tubules themselves. So remember, the tubules are part of that nephron where we get substances able to go back and forth. So that can be water or electrolytes or glucose, for example. And if you damage those tubules, again, you can get something that's called acute tubular necrosis. So that necrosis is telling you that there's death occurring. These tubes are made up of cells. So these cells require oxygen, and when they don't get that oxygen, those cells die. Which means acute tubular necrosis is secondary to ischemia. Secondary to ischemia, which means those cells aren't getting oxygen. Those cells aren't getting fed. Those cells are being underperfused, hypoperfusion, renal hypoperfusion. That's what we spoke about here in the pre-renal causes, which means if the pre-renal isn't fixed, isn't sorted, then you can result in an acute tubular necrosis. So these are intrarenal causes of AKI. What about post-renal? Well, when we look at post-renal, this is happening after the kidneys and usually has to do with some sort of obstruction, which is then working its way back into the kidney, causing damage. So where are the three major places that could be obstructed after the kidneys? Well, it could be the ureters, it could be the bladder, or it could be the urethra. And it's going to be some sort of obstruction. And if you obstruct these, then again, the pressure is going to work its way back and start to damage the kidney itself. So, what could happen? Well, in all three, you could have some sort of tumour. Right? So, some sort of tumour is going to cause an obstruction, potentially. When it comes to the ureter and the bladder, you could also have some sort of calculi. It's a calculi, it's a stone, it's a kidney stone. And the kidney stone could be causing some sort of blockage. You may be asking, why not in the urethra? Usually once it gets to the urethra, that tube's wide enough to be able to get rid of that stone. Now when it comes to the bladder, if we're looking at the neck of the bladder, sometimes prostatic hyperplasia, so if that prostate starts to get too large, you can start to push on the neck of the bladder and cause some obstruction. So prostatic hyperplasia. We might leave it there. That's a good couple of causes for acute kidney injury. So remember, acute kidney injury is in a window of 48 hours, so it's a sudden onset. It's damaging the kidneys in a way that's affecting its function, so it can't filter. It results in an increase in products in the blood that should be excreted by the kidneys. And the way it manifests clinically is by looking at serum creatinine, BUN levels, so blood urea nitrogen, and also if the patient has a reduced urine output or reduced urine volume, which is oliguria. There's three particular categories of AKI, which is pre-renal, before the kidneys. Now this has to do with hypoperfusion, so reduced blood flow to the kidneys itself. And there's a number of different causes we spoke about. It could be intrarenal, so this is damage to the tissue of the kidney. So I said it could be the vasculature of the kidneys, could be the interstitium, could be the tubules, and it could be the glomerulus. I forgot that one, had to turn around. And post-renal, well, this is happening after the kidneys, and it can be the ureters, the bladder, and the urethra. So that's acute kidney injury. I hope it made sense. Any queries, please let me know. Thanks.